Bill C7 includes 3 provisions with relevance for MAID to MAID for persons with mental illness. First, it says mental illness is not an illness, disease, or disability for the purposes of MAID eligibility criterion of a serious and incurable illness, disease, or disability. This statement has the effect of excluding the majority of persons whose mental illness is their sole underlying medical condition. Second, this exclusion is to be automatically repealed on March 17th, 2023. Third, it requires the Minister of Health and Justice to cause an independent review to be carried out by experts respecting recommended protocols, guidance, and safeguards to apply to requests made for medical assistance in dying by persons who have a mental illness.
So I seem to remember that got postponed, right? It got pushed back.
Yeah, now it's pushed
didn't
back
get
to
approved?
March 2027.
Oh, okay.
So I thought this was an interesting little caveat in here on First Nations, Inuit, and Métis people. Indigenous people in Canada have a unique perspective on death, which need to be considered in the context of emergence of MAID, including MAID and MDSUMC, which is the medical side of it. However, engagements with Indigenous people in Canada concerning MAID has yet to occur. I wonder if they've killed any Indians with it.
Oh, they must have.
Yeah, I guarantee you they have. Through the harmful policies and practices of colonization, such as residential schools. I mean, like MAID isn't a harmful practice. I mean, and through legislation, the federal government has a history of causing harm to First Nations, Inuit, and Métis people. So we're not going to MAID them, just the whites. I don't think it says that. Inuit, Métis, compared to the non-Indigenous Canadian population, a disproportionate number of Indigenous people live in poverty, have inadequate housing, a lack of clean drinking water, and have limited access to education and healthcare. Anti-Indigenous racism is also widespread in Canada's healthcare system. As a result, the creation of laws that provide access to MAID, concerns have been raised by Indigenous leaders and communities that is easier for people in their communities to access a way to die than to access the resources they need to live well. But let's keep fighting to stay in Canada.
Wow. Oh my God.
At the same time, some Indigenous people in Canada embrace the concept of MAID and wish to support their families and communities through access to the same. Ooh. I mean, do you know anyone who's just stoked to kill their family?
No.
Most of the family dynamics I know are older people considering it and their children being mortified.
Yeah.
At the same time, it is well known that First Nations, Inuit, and Métis, especially in rural and remote areas, experience limitations in accessibility to healthcare services in Canada. Careful consideration needs to be given by all levels of government to policy and resources that ensure Indigenous people seeking MAID are afforded equitable access in their home community. So we got to make sure we can kill the Indians too. Enough to put it in here as a line item. I mean,
equal rates. Wow.
We're the fastest growing demographic right now, so that means they need to really up the MAID to slow that down. To more clearly identify which conditions fell within the panel's mandate, the panel must compare the description of mental illnesses above with the federal government's stated rationale for its exclusion cause, namely that there is disagreement among experts concerning when a mental illness can be considered irredeemable. Capacity assessments are more difficult to conduct given that symptoms of mental illness can affect a person's ability to understand and or appreciate the nature and consequences of treatment decisions. The trajectory of mental illness is generally harder to predict, and the desire to die is a symptom of some mental illness.
I thought that was Snoop Dogg there. The desire to die.
A patient must consent to any proposed medical intervention, including MAID. Consent must be provided by a capable person. Wouldn't that like rule out mental illness like right away? All adults, including those with mental disorders, are presumed to have decision-making capacity to provide informed consent or refusal. Oh, okay. So even if you have a mental disorder, we're just going to say it's fine. However, this presumption may be displaced if it can be shown that there are reasonable grounds to conclude that a given person lacks capacity in relation to a particular decision. In such situation, a person's capacity to decide about a given intervention must be assessed, which basically boils down to if you don't have a family member that's fighting for you, the government is just going to kill you because they're not going to argue for any of this on your behalf. Clearly, they've been just upping the numbers and expanding it. They want to get kids in now. They want to get kids so they don't have to ask their parents anymore. I mean, it's out of fucking control. Suicidality. Parliament, in legalizing MAID, affirmed that in certain cases, a desire to bring one's death is rational, understandable, and can be assisted without violating the criminal code. The set of cases where this apply are described by the eligibility criteria. However, in considering MAID requests for persons who have mental disorders, it must be recognized that thoughts, plans, and actions to bring about one's death may also be a symptom of the very condition for which MAID is being requested. Of the 157 mental disorders in the DSM-5, 4 main diagnoses include suicidality as a potential symptom of the disorder. Psychiatric diagnoses are syndromes, meaning they are defined by a list of features, not all of which may be present in an individual case. This means that even if a person has a diagnosis for which suicidality is a symptom, this individual may not have that symptom. So,
oh my God, that's a good gray area there, right?
We got to make as much gray as possible. Furthermore, the vast majority of people with mental disorders, including these diagnoses, do not die by suicide. That said, there is a strong association between completed suicide and the presence of mental disorder. In the suicide literature, there is some variability as to the. I mean, at this point, if they shouldn't it just be good for suicide too? At this point, does it really matter? What difference at this point does it make?
What do you mean? What do you mean it should be good for suicide? I mean, that's what this
Well, I mean,
is.
at this point, that you couldn't just go in there and say, I'm sick of it. You know, that's not a good enough reason.
It's not right now.
Broadening it so much that you know
it is. It isn't that good enough reason.
No, you have to have a mental disorder, and
no, you don't. No.
Yeah.
No.
Yeah.
No, you can request.
You have to have an incurable or end of life thing like within reach
or something like that. You have to have a morbidity, a comorbidity.
Yeah, so I guess you just can't decide you want to have it over with. So here's some examples. B is a 56-year-old man referred for a MAID assessment by his family doctor.
Oh my God.
For severe pain for 3 years, unresponsive to intervention. The patient stated, "This pain is killing me and I don't want to live like this." He said he received no help from the pain clinic. The pain clinic reported that he has attended on 4 occasions. He refused the treatment options, including oral and injectable medications, as well as physiotherapy. He insisted on receiving prescriptions for opiate anesthetics,
analgesics,
and became verbally abusive when these were refused. According to the GP, the patient had been fired from his job 3 years ago for alcohol intoxication at work. He had been drinking heavily for a number of years and had assaulted his wife on several occasions while intoxicated, blaming her for her problems. During the assessment, he says, "After I get MAID, I hope my ex-wife feels really guilty. It's her fault. I will be dead." I'm guessing that one got denied, right?
No, I mean, what?
P is a 58-year-old person with
because it wouldn't be denied because he's in pain and the pain's killing him, right? So
P is a 58-year-old person with OCD and more recently chronic pain following an automobile accident. They have requested MAID primarily due to the suffering caused by obsessive compulsive disorder, although their pain plays a role in their request. They have tried one medication to treat OCD so far, but stopped it due to side effects. They have participated in a mindfulness group therapy program. They are unwilling to try pain medications because they fear becoming addicted to them. That sounds worse than being dead.
I know, it's weird. That's so
when their psychiatrist recommended another medication to treat OCD, they were unwilling to discuss it because they had side effects from the first one they tried. They are not willing to try exposure and response prevention therapy, which has the best research behind it. They are not open to learning anything more about it from the assessor.
So I don't know.
Here we go. Assessors should ensure that a requester's wish for death is consistent.
Oh, hang on. That's recommendation for B, isn't it? Or
that's recommendation 8. They don't seem to correlate. By itself, a request made by a person with a mental disorder should not be interpreted as suicidal ideation, even if suicidality is listed as one of the diagnostic criteria for the person's mental disorder. I mean, what a crazy sentence. Since the majority of MAID requests will fall under Track 2 and require a minimum 90-day assessment period, the requirement of proximate harm to self and mental health legislation of most provinces and territories to permit involuntary hospitalization is not met by the simple fact of making a MAID request. Here's another example. C is a 70-year-old woman with severe major depressive disorder and post-traumatic stress disorder diagnosed at age 18. She has expressed her desire to die since she was 20 years old and made approximately 30 suicide attempts during her life. I mean, at that point, I'm in, made her, right? I mean, at this point, she tried killing herself 30 times. I mean, she's just going to slash her wrists again. You might as well just throw her in the pod. She has no plan to attempt. She has requested MAID because the symptoms of her disorders have been refractory to over 35 recognized psychosocial interventions and somatic treatments, and she does not want to try anymore. She has no plan to attempt suicide at present. I don't think we need to get into that. Persons in situations of involuntariness for periods shorter than 6 months should be assessed following this period to minimize the potential contribution of the involuntariness on the request for MAID. For those who are repeatedly or continually in situations of involuntariness, which I guess is when you can't mentally make your own decisions type thing.
Yeah.
The institution responsible for the person should ensure that the assessments are made or performed by assessors who do not work within or are associated with the institution, because they might want her to still live so that they could keep getting paid, or maybe they've got attached to her. F is a 40-year-old man who had to stop work due to a combination of physical weakness and loss of ability to plan, organize, and complete tasks, as well as changes to memory and concentration. He does not have a low mood. He believes that he has a serious neurological disorder, but neurological investigations have been normal. He requests MAID on the basis of the neurological disorder and becomes angry when the first assessor suggests that he may be suffering from a psychiatric disorder. He repeatedly emails and calls the assessor's office to insist that the neurological investigations are incorrect. He makes a complaint to the College of Physicians and Surgeons about the assessor. Finally, he calls the assessor's secretary and demands to speak to him on the phone. Get him on the phone or you will seriously regret it. Okay, down here at the bottom. I mean, those are crazy examples, right? We're driving people crazy.
Yeah, I don't even know what to think about it, to be honest with you. I just don't know. Like, if I don't know what to think.
It should just be privatized. I don't think I want the government involved, who's also in charge of our healthcare, because it's just too much.
Are there insurance implications?
And America, we could do GAID.
Yeah.
I don't know. To date engagement, you wouldn't get your insurance if you killed yourself, I'm assuming. To date engagement with Indigenous peoples in Canada concerning MAID has yet to occur because of the regional, cultural, and historical differences of First Nations, Inuit, and Métis people across Canada. The process of engagement will be most impactful if done by regulatory bodies in each province. This is not only a requirement of legislative processes in some provinces, it's also necessary to ensure local standards of practice reflect the histories, values, and perspectives of First Nations. So they'll throw some feathers in the pod with you. Working collaborations with regional Indigenous health authorities and advisory bodies individually or through formation of a collective advisory body could be the most effective and timely way to proceed. I mean, it really seems like they're trying to convince Indians to kill themselves. Due to the sensitive nature of these consultations, local Indigenous communities may choose to seek advice from elders, knowledge keepers with respect to ancestral spiritual knowledge and teachings related to assisted dying. The federal government should play an active role in supporting the development of provincial and territorial systems of MAID case review for educational and quality improvement things. Elderly persons with mental disorders. One of the implications of the current legislation is that physically frail elderly person or an elderly person with multiple medical comorbidities seeking MAID primarily due to a mental disorder could be eligible under the Track 1 safeguards. Under current MAID law, a person with physical conditions accepted as a serious and incurable illness, disease, or disability, but who's in an advanced state of irreversible declining and enduring intolerable suffering are primarily due to a mental disorder, could meet the legislative definition of egregious and irredeemable medical condition. Thus, two people seeking MAID for a mental disorder, one who is frail or has multiple medical comorbidities and is elderly, and one who is not, might be approached differently. Um,
I mean, that intellectual disability one is interesting because that's
That'll
going
be
to
you.
talk about the. That'll be me. Yeah.
As noted above, the federal government has stated that people with neurodevelopmental and intellectual disabilities are not covered by the mental illness exclusion clause. This means they may request or be considered eligible for MAID at present. So that's like the autistic kids. However, some of the concerns raised about mental disorders could also apply to a person with intellectual disabilities. The panel identified 4 possible scenarios of requests involving this group of persons. 1, a person with an intellectual disability and a comorbid physical condition whose natural death is reasonably foreseeable. A person with cancer, terminal cancer. A person with an intellectual disability and a comorbid physical condition whose natural death is not reasonable foreseeable. Example, a person with epilepsy. 3, a person with an intellectual disability and a mental disorder. And 4, a person with an intellectual disability alone. The first 2 categories of people could potentially be eligible for MAID on the basis of their physical condition. Such requests could proceed under Track 1 and Track 2 safeguards, respectively. Persons in the 3rd and 4th categories may also be potentially eligible if their intellectual disabilities are taken to be serious and incurable illness, disease, or disability, like autism. Requesters who are incarcerated, so this just goes through the jail numbers, which is we're up to adults serving custodial sentences of 2 years or more, housed in federal, blah, blah, blah. As of March 31st, 2022, there have been 5 assisted deaths of prisoners in federal prisons. So MAID represents only 2% of total federal prisons deaths. And the Canadian rate of MAID deaths in 2020 was 2.5%, which I think was up to like almost 5% now, right?
Yeah, I think you got
1 in 20. Conclusion. In a MAID regime based on a person suffering from a medical condition, singling out certain diagnoses for exclusion does not map easily onto the complexity of illness and human experience. Furthermore, focusing only on the vulnerabilities of one group, persons with mental disorders, can neglect the potential vulnerabilities of many other requesters. This report is the beginning of a process, not the end. The panel has offered initial reflections on how to address some of the complexity existing in certain areas of MAID practice. More work will be required by many actors in Canadian society to ensure MAID for persons with mental disorders, and indeed MAID practice more broadly, evolves in a way that responds appropriately to those Canadians who wish to avail themselves this option. I mean, is there a better way? Could you come up with a better way to say it than that?
Some of it makes sense. I mean, some of it is like I like the way they teased apart some of those things. Like if you have depression, which suicidality could be a thing, that doesn't mean you're suicidal. Like they've identified some of those things. But it's just there's all this labeling and all this. It just I feel like it's a can of worms that